I would also like to thank the Health Secretary for his personal commitment to patient safety in including the HSIB bill in the Queen's speech, and the Minister for her personal commitment in getting it in both last year's Queen's speech and this one, despite many competing pressures. And it is about patient safety that I would like to talk in my brief 6 minutes. When I became Health Secretary in 2012, I had not heard of the phrase patient safety. And the first crisis that I had to deal with was mid-staffs. And I remember the then Chief Executive of the NHS, Sir David Nicholson, taking me aside and saying, "You just need to understand, Jeremy, that in healthcare we harm 10% of patients. That's what happens all over the world." And I then asked the awkward question as to how many people actually die because of mistakes in healthcare. And it's very important to say this is not about the NHS, this is about how healthcare is practiced everywhere. But being the good old NHS, we've done endless academic studies on this, and the Hogan and Black analysis shows that at that time it was 4% of hospital deaths have a 50% or more chance of being preventable. And if you do the maths, that works out at about 150 preventable deaths every single week. That's an aircraft falling out of the sky every single week. And then I met a group of people who persuaded me this should be my main focus as Health Secretary. I met Scott and Sue Morris, a young couple from Devon who lost their son Sam to sepsis when he was 3 because it wasn't picked up early enough. James Titcombe, who lost his son Joshua at Morecambe Bay when he was 9 days old. Deb Hazeldine, who lost her mother in a horrible death at mid-staffs. Martin Bromley, who lost his wife Elaine because of a surgery error at a hospital in Milton Keynes. And Melissa Mead, who lost her son William at just 12 months when I was Health Secretary in December 2014, again because sepsis wasn't picked up. And what all these people did is something that most of us would never do. Most of us, when we have a tragedy in our lives, we want to close the chapter and move on. But they chose to relive their tragedy every single day because they wanted to tell the story and make the NHS change so that other families didn't go through what they had been through. And they paid a terrible price for doing that. James Titcombe had to write over 400 emails over several years before we were prepared to admit why Joshua died. Martin Bromley sacrifices 40% of his salary as an airline pilot so he can go around the NHS talking in hospitals free of charge about what happened to Elaine. Melissa Mead carries William's teddy everywhere she goes in the TV studios to try and alert people to the dangers of sepsis. She brought it to her first meeting with me. Inside that teddy were William's ashes. That's a meeting you never forget as a minister. And we mustn't let this blind us to the fact that the vast majority of NHS care is absolutely brilliant. I have 3 beautiful, healthy children, thanks to the NHS. About a year before I was Health Secretary, I was in the Cabinet. I had a BCC removed from my head, and the local anaesthetic was administered. The surgeon had his scalpel out, and the head nurse looked at me and said, "By the way, Mr. Hunt, what is it you do for a living?" I froze. It was a time of austerity and cuts, and I froze before giving the answer to that question. But thanks to substantial additional funding by the last Labour government and substantial additional funding by this government, the NHS has improved dramatically, and we now have record survival rates for every major disease category. I give way to the Honourable Lady.
I thank